Let's meet our contenders. Amoxicillin, erythromycin, azithromycin. All very useful, very helpful antibiotics, but why have them when you can have penicillin? Penicillin is a group of antibiotics derived originally from common molds known as penicillin molds, which includes penicillin G, intravenous use, penicillin V, use by mouth, procaine penicillin, and benzathine penicillin, intramuscular use. Before we move any further, I'd like to point out the pyramid you see before you. On this pyramid, it discusses the schedule's classifications. Schedule 1. Substances that have not currently been accepted for medical use in the United States, a lack of acceptance for safety for the use under medical supervision, and a high potential for abuse. Schedule 2. Substances in this schedule have a high potential for abuse, which may lead to severe psychological or physical dependence. Schedule 3. Substances in the schedule have a potential for abuse less than substances in Schedules 1 or 2, and abuse may lead to moderate or low physical dependence or high psychological dependence. Schedule 4, where penicillin fits. Substances in this schedule have a low potential for abuse relative to substances in Schedule 3. And finally, Schedule 5. Substances in this schedule have a low potential for abuse relative to the substances listed in Schedule 4 and consist primarily of preparations containing limited quantities of certain narcotics. Now that we've taken the time to learn about the different schedules and classifications of drugs and how antibiotics, like penicillin, fit into Schedule 4, let's go ahead and talk about the fact that there are a number of different drugs that your dentist may prescribe depending on your condition. There are some medications that he or she could prescribe to fight certain oral diseases, to prevent or treat infections. Things like that, your dentist is most likely going to prescribe an antibiotic, like penicillin. For example, after a tooth extraction, I myself was prescribed penicillin. Hi, my name is Dr. Pecton, and thank you so much for meeting with me. I'm going to go ahead and teach you how penicillin is made today. Penicillin is made from a mold called penicillium, which naturally produces the antibiotic penicillin. Scientists like me have learned how to create this penicillin mold in deep fermentation tanks. We do this by adding a sugar and other ingredients, and this speeds up the growth of penicillin. After that's done, scientists then separate the penicillin from the mold. Once this has been completed and the penicillin has been separated, it is then purified into a form to be able to create the antibiotic medication for you, your loved ones, your enemies, and your friends. Now that we've learned how penicillin is made nowadays, let's take it back to 1928 and learn about the man who figured it all out. The first name for penicillin was mold juice. Scottish bacteriologist Alexander Fleming accidentally discovered the antibiotic in 1928 when he came back from a vacation and found that a green mold called Penicillium notatum had contaminated petri dishes in his lab and were killing some of the bacteria he'd been growing. So he isolated this mold, grew more of it, and then experimented to see how many of the bacteria it could kill. Lots of them, it turned out. We now know that penicillin works by preventing bacteria from forming new cell walls. No new walls, no new cells, no bacterial growth. Fast forward to 1938, where Oxford pathologist Howard Florey discovered Fleming's research and expanded on it. Working with a biochemist named Ernest Boris Chain, who had fled Germany, British biochemist Norman Heatley further developed the work, vigorously growing and purifying penicillin. After much research and experimentation, as well as a trip to the United States, where Florey and Heatley worked with the American scientists, an injectable mass-produced form of penicillin was ready by 1942. That was just in time to help the soldiers wounded in World War II. The numbers prove the point. Bacterial pneumonia killed 18% of fallen soldiers in World War I, but in World War II, it killed less than 1% of soldiers. Penicillin went on to change the way we treat illness and wounds, and it all started with mold juice. Now that your brain is jam-packed with information regarding penicillin, what schedule of drug class it goes into, how it was made, and who made it, why don't we go ahead and meet with one of our youngest testimonials on why she chooses penicillin?
Make me feel better soon.
Well, there you have it, folks. Can't argue with that even if I wanted to. That cuteness right there explains to you why penicillin is the far superior antibiotic for you. Whenever you're at the dentist getting an extraction, have an infection, ask your dentist to prescribe penicillin.